The advantage of added value strategies compared to new chemical entities, there's less data required. There are special regulatory routes, particularly in America, the 505(b)(2) route, but there is also not so successfully a hybrid route in Europe. Development costs, development times, exclusivity, lower risk of failure because you are dealing with a drug where you already know its safety profile because it's not a new chemical entity, it's a drug already on the market. Its advantage compared to conventional generics, the end product should gain a significant price premium. You will notice I put the word should in red. And we will be, over the next 3 days, we'll be looking at the fight that we have, those of us who are protagonists for added value, the fight we have, which is getting better. I would say I'm more optimistic this year than I have ever been about an acceptable promotion, particularly for repositioned drugs. More and more countries are coming out and saying, we believe we must support this, there is value. So the advantage for against generics, exclusivity to some extent, patent protection, if you're clever, there is higher investment, less data requirements, lower development costs. The drivers, which we will look at in more detail, combination products, that's your polypharma, with improved activity, reduced side effects maybe, more convenient is the major one. Formulation or dosage forms, improved efficacy, modified release, pediatrics. Route of administration, rarer. This would certainly be for the biologics, switching from intravenous to subcutaneous, for example. Unmet medical needs, a rare occurrence, but coming out of repurposing, and quite a number of the repurposing products or repositioning are actually coming out as very good for specific patient populations. And then rarely you could have manufacturing advantages where you have a more cost-effective process.